A suspicious device placed outside a federal building in downtown Oakland prompted evacuation Wednesday afternoon. Investigations later ruled the device an incident as a hoax. FBI Special Agent in charge, Jonathan Blair, said the event happened near the federal building in Oakland. Around 12:40 p.m., the Federal Protective Service reported seeing an individual placing a device at the base of a flagpole in the plaza. Law enforcement agencies and helicopters arrived on scene, evacuated the area, and closed a portion of streets in the downtown area near the building for roughly 5 hours. The Alameda County Sheriff's Office said the device had the characteristics similar to a pipe bomb. A bomb squad examined the device and determined it to be safe, calling it a hoax device. The investigation found the device included a note for law enforcement and officials. The county sheriff's office did not specify the exact contents of the note, but said whoever put it there wanted to elicit this type of response. Officials said whoever is responsible could face charges for weapons of mass destruction. Los Angeles County Sheriff Alex Villanueva stated that while some crimes have gone down during the pandemic, homicides and grand theft auto did not. We'll hear more from NTD's David Lam.
In a span of 2 years, violent crimes in Los Angeles County significantly increased. That's according to LA County Sheriff Alex Villanueva.
Obviously, the most glaring number right here is a 2-year increase of 94% on homicides and grand theft auto increase of 59%.
The sheriff discussed a variety of topics, including crime, jail violence, and staff shortages during his review of the county's 2021 statistics on Wednesday.
Overall, you can see some crimes went down. A lot of this is still pandemic related. Obviously, the societal patterns, behaviors, people at home, businesses closed. It disrupted a lot of cycles of crime and opportunities for crime.
According to the sheriff's press release, the percentage of inmates suffering from diagnosed mental illnesses is up to 36%, and the lack of staffing due to budget cuts has impacted violence in the jails. Villanueva said starting on February 1st, 50 body-worn cameras will begin being used inside a jail. It's part of a pilot program. He added that since 2018, a total of 949 personnel members have been disciplined and 132 have been discharged for offenses such as use of alcohol, false statements, and excessive force. David Lam, NTD News, California.
On Thursday, San Francisco officials gave an update on the city's recent response to COVID-19, also known as the CCP virus. Both of them spoke with cautious optimism about getting through the recent wave.
San Francisco Mayor London Breed and Department of Public Health Director Dr. Grant Colfax gave a COVID update on Thursday, saying cases of the Omicron variant have already plateaued.
COVID-19 cases dropped relatively rapidly in the city, and we can now confidently say that we are on the beginning of a downward trajectory with regard to this surge.
According to Colfax, COVID cases peaked on January 9th with a 7-day average of 2,164 cases per day, and it dropped to 1,076 cases per day on January 12th. Since Omicron is more transmissible than previous COVID strains, they expect more patients at healthcare facilities for a few weeks.
It's highly infectious. It's been very challenging. People are getting it, and the good news is that people, for the most part, are not ending up in the hospitals and dying in numbers like we've experienced just this last year before.
Colfax expects that the cases will peak this week, and it won't overflow current hospital capacity. He warned people that the number of cases is still high and recommends wearing proper masks.
That we need to learn to live with this virus, so we're not going to hold on to restrictions and just waiting for Omicron to go away or COVID to go away. It's clear that that's not going to happen anymore.
As of Thursday, the city of San Francisco reported 82% of the city is vaccinated and 62% of the city has received a booster shot.
Healthcare workers say there are hours-long waits to transfer patients from ambulances to hospital emergency rooms. The situation has increasingly worsened over the last 2 years.
Emergency health workers and first responders provided testimony about the long wait times they experience for a hospital to receive a patient at an emergency room. During a legislative hearing on Wednesday, they say it isn't good for the patient and it also keeps them from heading out for other emergency calls.
When ambulances are being held at local emergency departments due to APOD and resources shift away from the Chino Valley, it's only a matter of time when a community member will likely die simply because they cannot get to the hospital.
First responders often end up waiting for hours with a patient at hospitals referred to as ambulance patient offload delay, or APOD, because no one is available to receive new patients. Doctors say this problem comes from delays in lab work, x-rays, and insurance authorizations.
Today, it is not uncommon for our paramedics to start rendering aid to a patient and then wait 30 minutes or more for an ambulance arrival to transport that patient to the hospital. I have personally waited longer than 80 minutes, yes, 80 minutes, on scene for an ambulance to arrive on multiple occasions.
Although they say these wait times aren't new, the COVID-19 pandemic, also known as the CCP virus, worsened the situation. California is seeing a rise in hospitalizations following a spike in Omicron variant infections. At one Sacramento hospital, it's become common to see a crowd of public and private ambulances lined up. Because of longer wait times at hospitals, ambulance response time has increased to about 12 minutes. Patient transfer should take no more than 20 minutes, but last year they were held up for over 2 hours more than 700 times. First responders believe hospitals should be held accountable for processing information for incoming patients.
As the committee seeks to address the APOD issue, we would also encourage the committee to consider rewriting outdated laws that simply do not help the current pre-hospital ecosystem use all of its current resources.
So we need short-term solutions, but we also need long-term solutions. And we need to look at regulations. We need to look at ways of streamlining things that make sense.
Earlier this month, the director of public health in Santa Clara County asked people not to use emergency rooms as testing centers.
A federal appeals court ruled that 2 counties in Southern California violated the constitutional right to bear arms. The counties shut down gun stores in 2020 as non-essential businesses during the COVID-19 pandemic.
Last year, officials in Los Angeles and Ventura counties separately won lower court decisions, saying gun stores were not exempt from broader shutdown orders aimed at limiting the spread of the virus early in the pandemic. A 3-judge panel of the 9th U.S. Circuit Court of Appeals rejected both lower court rulings. A judge wrote the Second Amendment means nothing if the government can prohibit all persons from acquiring any firearm or ammunition, but that's what happened in this case. During the lockdown, Ventura County closed gun shops, ammunition shops, and firing ranges for 48 days. The judge said the order wholly prevented law-abiding citizens in the county from realizing their right to keep and bear arms. He also noted that bike shops were allowed to remain open as essential businesses.
Amazon's recipe for a department store of the future includes an algorithm to help you get dressed, and what one corporate director called a magic closet in a fitting room. Let's take a look.
Amazon is making another push to grow its fashion business, announcing on Thursday it'll open its first ever apparel store this year. But as with many of the online retailer's ventures, the store will have a tech twist. At 30,000 square feet, the planned Amazon-style shop near Los Angeles is smaller than the typical department store. Model items are on the racks, and customers scan a code using Amazon's mobile app to select the color and size they would like. To try on the clothes, which are stored in the back, shoppers enter a virtual queue for a fitting room that they unlock with their smartphone when it's ready. Inside, each dressing room has a touch screen, letting shoppers request more items that staff deliver to a secure 2-sided closet. The touch screen suggests items to shoppers, too. Amazon keeps a record of every item a customer scans, so its algorithms personalize clothing recommendations. Shoppers can fill out a style survey as well. By the time they arrive in a fitting room, employees have already deposited customers' requested items and others that Amazon has picked. Shoppers can opt out with a concierge's help.